Hey, welcome everyone. It's just past 1 o'clock on this Wednesday. We're thrilled to have you join us. I'm Jamie Ratner-Rich, the current Vice President of the Jewish Community Relations Council, and I'm so excited to be kicking off our first JCRC talks. Our communities are faced with so many challenges today, and I'm so thankful that we have so many amazing partners to help us learn about the different challenges of the many communities that we work with on a day-to-day basis here in the greater Indianapolis area. So today we'd like to start with a little conversation surrounding the health disparities in the African American community here in Indianapolis. I felt so fortunate during my last visit in the Stanley K. Lacey Leadership Series to just hit the tip of the iceberg about the challenges that this community faces here and the clear lack of access, lack of opportunities, lack of services that are truly impacting folks right next door to us. So we have 4 wonderful people here today to share some of their thoughts. We have Representative Robin Shackelford, who represents the Indiana House District 98. She serves as the ranking minority member of Public Health Committee, so has lots of things to share with us today, and also serves as chair of the Indiana Black Legislative Caucus. And in her day job, she also works as an independent travel consultant, so I'm sure she has lots of things to share with us from that perspective as well. We're also going to have Tony Mason join us. Tony is the president and CEO of the Indianapolis Urban League. And prior to his time at the league, he served as executive director of the Circle City Classic and was an SVP of the Indianapolis Super Bowl Committee. We also have Marshawn Wally with us today, who also serves as policy director with the African American Coalition of Indianapolis, is also a columnist with the Indianapolis Recorder, and has recently launched Black Onyx, a management company focused on marginalized communities. And last but not least, Representative Greg Porter has joined us today, representing Indiana House District 96, serving as the ranking minority member of the House of Ways and Means Committee. And outside of the State House, he serves as the president of the National Black Caucus of State Legislators. During the day, he serves as SVP of External Affairs for the Health and Hospital Corporation of Marion County. So also we'll have lots of perspective into this for us today. Right now, I'd like to turn it over to Representative Shackelford, who recently met with the IBLC meeting on the governor on these very issues regarding the disparities in our community. Please kick us off.
Thank you, Jamie. So as Jamie mentioned, last Wednesday, the Indiana Black Legislative Caucus met with the governor to go over some of these health disparities, economic and education disparities that have basically been highlighted and shown now that COVID-19 has taken place. We all know these disparities have already existed in these different areas, but now with this such crisis in this virus, those disparities are being highlighted. So we had initially sent the governor a letter requesting that the data and race data be released. And so they released that data. And then once they released it, we saw that African Americans were actually getting the virus at higher rates, and they were actually dying at higher rates. So we sent a list of 8 recommendations and requested a meeting so we can talk to him in person. Once we got those recommendations together, got the meeting, they also requested that we give them information on how it should be funded through the CARE Act. As you guys know, Indiana currently got about $2 billion from the federal government to help with COVID. So they spent about half of it because that first half had specific guidelines on how it could be spent. And now they have about 50% left. So they're looking for input and requests on how that money should be spent. So I'm just going to go over about 5 of those areas that we listed on how the money should be spent and gave them some recommendations. We did ask for them to get back with us in a couple of weeks, so next Friday, on what they feel about these recommendations or would some of these things be funded. The first was to create actually a health disparities task force. I would say made up of minorities that's actually already working in the space. And there you have the Indiana Minority Health Coalition, who's been doing this work daily. They have over 20 coalitions across the state that works on disparities. So we recommended that they actually give extra funding to that organization to work on and come up with a task force and a correction active plan for COVID and how can we address these disparities. Then we talked about testing and triaging in Black neighborhoods or minority neighborhoods. When you guys see their first 20 testing sites that they open, I would say it doesn't look like that they took the facts into place as far as where African Americans are located. So we also provided them the top 20 cities in Indiana based on African American population. If we're not going to have COVID information by zip code, then use this data to help drive where those testing sites should be. So they're planning to do 30 more testing sites across the state. They have a total of 50. We've sent out maps of where those testing sites are. So far in Marion County, there was about 3, but they're not located in African American neighborhoods. I just want to do a caveat. The ones that were at Eastern Star and at Wineskin was not supported by the state funding or any of their funding. That was actually supported by the funding from Marion County and also IU Health. So we're asking for some of these funds that the state have to actually put these testing sites in African American neighborhoods that they will be producing. Next, for essential workers, making sure that they're getting hazard pay and a living wage. We know that there is a large portion of African Americans that are essential workers, whether it's in retail, bus driver, healthcare, in the nurses, or in the staff that clean up. So providing some type of fund to increase their reimbursement through Medicaid, like they did for long-term care. So long-term care, you guys know the nursing homes have been heavily hit. So they increased their rate by 4.2%, their Medicaid rate, to help not only attract workers and to retain workers, but give them some kind of hazard pay. Within the nursing homes, they have split up the units. So you will have a COVID unit and you will have people without COVID. And those employees that work in the COVID union just work in the COVID unit. So you need to give them some type of extra money, hazard pay, if you're going to have them exposed and working in these types of units. Now, I do just want to give in a caveat. Our nursing homes have been underfunded for over years. They're working under a 3% cut from Medicaid. So the 4.2%, it was a benefit, but you're mainly looking at like a 1.2% since they were already working at a 3% deficit. So if we're going to be serious about making sure that these essential workers are getting a living wage and a hazard pay, we're going to have to put money into that and somehow subsidize what employers are already doing or do it through Medicaid, what we're paying out, and increase rates. We also talked about just the data collection. We definitely need this data by zip code. So the state has already contracted with Fairbanks. We said, why can't you have Fairbanks now get this information by zip code and get it out to the public? They did give a little pushback here because they said as they look at the zip code data, it's so limited. There's only a certain numbers and small numbers in all these zip codes. But we pushed back and said the zip codes that you know have high numbers like 46218, which Dr. Box did agree that that zip code she can just name off the top of her head because that's over here on the east side of Indianapolis, and that zip code has the worst healthcare rates, the highest homicide rates, the worst employment rates. So you don't even need data for that. But if you already know that, then why don't we have resources going to help out African Americans in that neighborhood, which should have been going out proactively, but now they definitely should be going out and setting up testing sites in that area. I'm just going to hit on one more because I see my time is going out. We asked for an outreach campaign specifically for African Americans. So African Americans, I know they're hearing this different information, whether if it's a hoax, we have the millennials still out here partying, getting together, but we need a campaign letting our community know how dangerous this disease is, particularly to their set, and what it means that it could be life or death. So something proactive out there. So we asked them to reach out to minority media, come up with some kind of campaign to let people know all the preventives that they should be doing and how serious this is. So there was a couple of other things that we asked for in funding. I just wanted to touch on making sure we increase funding for public health, which has been underfunded for years. And at this point, we're seeing the impacts of not funding public health, whether it be for heart disease, diabetes, some of those illnesses that we know African Americans have pre-existing, and then COVID just makes it worse on top of these. And I wanted to hit on one more, providing technical assistance to small businesses and nonprofits. The federal funding that is available, the application, the documents you have to get is so complicated. You need assistance from a CPA or an attorney. So we asked the state to partner with a lot of the African-American professionals, like the National Association of Black Accountants, the Association of Black Attorneys, and see how they can partner with them and get them to provide technical assistance. So I will end it right there. I don't want to take up everybody else's time.
No, those were amazing points, Robin.
Yes.
Thank you so much. I think when I'm listening to you and hearing the points that you're making, none of these are new. You're exactly right. That zip code just jumps off the page at me, of course. And your comments surrounding awareness campaigns feel so critical around all of those issues, and the access the communities have to educational components to help themselves has been so limited. You're so right, how we could direct that. The League works to do some of those things, as does Tony. Has so many advocates out in the field right now doing so many great things. Tony Mason from the Urban League, I hope you will share with us a few things. And before you do, to everyone tuned in today, again, we want to thank you, but make sure that you utilize your chat feature to send your questions in as the panelists are going and sharing some information with us, and I will be helping redirect some of those questions. So please do open your chat feature and fire away, and at the end of our comments, we will be sure to do our best to answer some of the questions you have. So over to you, Tony.
Sure. Jamie, I want to thank you and the JCRC for having me on today, and definitely want to commend the Indiana Legislative Black Caucus for the work that it's doing to address these disparities, as well as the work of Dr. Kane in particular. The Urban League, many of you do not know it. Our mission, of course, is to assist African Americans, other minorities, and disadvantaged individuals to achieve economic and social equality. But one of our operating pillars centers around health and quality of life. And that's really about working to build healthy and safe communities and to eliminate health disparities through prevention, healthy eating, fitness, as well as affordable health care. And so we center a lot of our programs and activities around that. We're working with special populations, and that's where we're doing health screenings, as well as counseling and supportive services to individuals that are HIV positive. We're also doing drug education and outreach in the community in partnership with the Marion County Public Health Department. We also have a number of health initiatives, such as family, food, and fitness, where we're really trying to get at obesity, if you will. And we're also addressing infant mortality, as well as smoking prevention and cessation through our team here. And so typically in a given year at the Urban League, we're providing services and impacting nearly 3,000 people. What's critical in all of this, and we talk about health disparities, is understanding the direct connection to poverty, if you will. And so we know that if we've got nearly 240,000 families in central Indiana that are dealing with poverty, and 38% of them are asset limit income constrained employed families, then we're going to have an issue with people getting preventive care, affordable health care, insurance coverage. And so at the Urban League, we put a concerted effort into trying to get people signed up for coverage. In dealing with the pandemic, one of the things that we've had to do, obviously, like most, we've gone to a remote operation, but every day our team we're processing requests for assistance with rent, utilities, and I know that we process now perhaps well over 100 checks and payments to support families that are in need. And then we've also started conducting weekly drive-through food distributions. And I can tell you that over the past 3 weeks alone, we have distributed food to well over 1,500 families.
Wow.
And so we know there's a major challenge ahead. And so as we hear discussion around the economy opening back up, businesses opening back up, what's probably not going to happen is not everyone's going to get their jobs back. So we think about 400,000 plus Hoosiers filing for unemployment. They're not going to get their jobs back. And many experienced a reduction in income and wages. There's no guarantee that their salaries are going to increase. And so if we had all of these disparities going into the pandemic, it is going to worsen. And so it's really going to be incumbent upon all of us, and particularly the participants on this Zoom presentation today, to do whatever we can to leverage our relationships and our partnerships to meet the needs in this community. And while obviously we know we're dealing with disproportionate impacts upon the African-American community, which we're part of the African-American Coalition. And of course, we recently issued a statement, if you will, urging people that who do not have to work, who do not have to be out in the public, stay home, stay home. We've not hit a peak yet. And I know that I issued a statement earlier today that appeared in the Star and is being distributed publicly about the fact that people have to be careful. You know, we had a tragedy that occurred in this community this weekend where a large group was gathered and a 16-year-old was killed by a stray bullet. The gathering itself made no sense, let alone the senseless loss of life. And so now more than ever, the community has to pull together to address these issues. When we think about Indianapolis and poverty, we think about our top 5 zip codes. When we talk about Alice poverty data that we have from the United Way, in zip code 46218, we're talking about a 74% poverty rate. 46201, a 69% poverty rate. 46222, 69%. 46225, 64%. 46224, 64%. This is Indianapolis, Indiana. This is not a third world country. This is happening in our community. And yes, there are a lot of systemic issues and inequities that we've all got to pull together to address. But if people don't have money to eat, how will they have money to take care of healthcare and things that are so critical?
I think that is such a valid point. And you're right, there are going to be so many challenges as we look to re-enter and
Yes.
what that looks like, and such an even greater amount of uncertainty when there were already challenges there. So
Yes.
the opportunity to meet people where they are, which was difficult prior to this crisis, has become even more difficult
Yes.
because they may not be in the same places, and the situation, to your point, has certainly worsened and looks more convoluted. Thank you.
Yeah. And Jamie, if I might add one more comment, even when we talk about telehealth now, think about the disparities that exist with respect to households that do not have access to broadband internet services or do not have a computer. We may take those things for granted, but if our largest school district, we're talking about 40% of households have this challenge. So telehealth, really? And if we're talking about e-learning, that's a whole nother challenge as well when we talk about the connection to education.
That we could spend hours on the education piece in this environment. Yes. I think it's a staggering challenge being the daughter of 2 IPS teachers who are since retired. When they heard about e-learning and IPS, I mean, there were definitely some explicatives coming out of my parents' mouths that how is that going to work? It is things that when I sit and look out my window are not the challenges that I am facing at all right now. So it is we have a big curve to face. Yeah. Marshawn, sorry, Tony, please.
And in fairness, we know that if that's a challenge with IPS, we know that's a challenge with all of the school districts.
It is.
And somehow we have to understand that collectively we've allowed this to happen. So we need a collective solution.
That's an excellent point. Thank you.
Yes.
Thank you. Marshawn, may I turn it over to you to share some of your thoughts today, please?
No, certainly. And I would first like to start off by thanking Michelle Corn with the partnership with Galilee, as well as David Scar. With the partnership, I had the opportunity to go to the Galilee region of Israel with my capable guide, David Scar, who's we're in the same SKL class together. That's like my brother from another mother. We share a lot in common. But I had a wonderful opportunity to learn about Israel beyond Israel being a country and being more than just a conflict. And I think that was very much important for me. And I've been trying to share that information here. Yes. So when you think about the African American Coalition of Indianapolis, it's probably best to think of us as an information exchange, where we're looking at the Black community or Black Indianapolis broadly. And when I say Black Indianapolis, we're talking about roughly over 230,000 people. When you think about that number, you put it in the context of other cities, Black Indianapolis would be the third largest city in the state of Indiana, just by population. Fort Wayne is around 260, 270. Evansville is about 117. So when you're thinking about a large population and a lot of the disparities inside of that population, it becomes critical to think about, the direction that this particular community is going and its impact, particularly on the city as well as the state. And so we are always just monitoring the disparities that really have been exacerbated by COVID-19 that have been in existence for a long time. Particularly when you're thinking about our COVID-19 response, I'd like to focus on our fight for data, trying to share the experience. And then we've also recently launched a public awareness campaign aimed at the Black community. And so I'll highlight those. So with respect to the data, the initial fight was trying to get the actual Marion County or even state data on what was happening with the Black community. And I'd like to thank the Indiana Black Legislative Caucus for really supporting us. I know with my Indianapolis Recorder hat, we reached out to a number of different institutions, but somehow it seemed like when the Indiana Black Legislative Caucus stepped in, the numbers just magically appeared. So very much appreciated that support. Once we learned about the numbers, the next challenge was engaging elected officials to act on those numbers. And so we did that, and we've really been pleased with the leadership of Dr. Kane and all the proactive measures that she's taken. And when you think about it, we should have known that this was coming. And in the leadership of Dr. Kane, she certainly knew that it was coming, and she did a number of wonderful things that I think Representative Porter would probably be able to better highlight than I can on just making sure that we were going to be in the best possible position to weather the storm. The other bit of data that we're currently going after right now is a business on the Paycheck Protection Program and Black business participation, particularly in that program. And so I've just gotten a response from a FOIA request. They did not give me the information that I was looking for, but I was able to jump on a call with the SBA yesterday, and it appears that they are tracking the information and they are very much aware of our interest in that data. And so we'll be, again, trying to get the data in order to get policymakers to react to the data, because we always want to act based on the information. So that's part of one of the hallmarks of the African American Coalition. The other thing that we've been doing, or at least what I should say one of our member organizations has been doing, is really trying to share the experience of the African American community under COVID-19. And we've been looking both at what's happening now from a health perspective and trying to share the health data, but also looking at different facets. So we mentioned education. We had a town hall with education leaders from Ivy Tech, Martin University, Lumina Foundation, as well as the University of Southern Indiana, and a partnership with New America, where we talked about the future of, college and what that's going to look like. But we also took the opportunity to interview area superintendents on their response to COVID-19. We spoke to both charter school leaders as well as the superintendent of Lawrence Township, IPS, and we've broadcast those on Facebook so that the community can see kind of how the superintendents have been impacted by this, what they don't know, what that they wish they knew. We've also had this conversation just on the racial achievement gap and what's happening and how are we supposed to, navigate the racial achievement gap in the middle of a digital divide. And so there's been some advocacy definitely in that space. We're also looking to the future and trying to get the community to think about the future. And so we've been talking about Black tech firms and other industries where we may not be in there now, but we are seeing that there's an opportunity and a need to be in different spaces. And so the Indianapolis Recorder has really been leading the effort on having these kind of conversations, both in their partnership with New America and then also with their own platform. Finally, well, in addition, one of the other things we've been doing, and this kind of came up, we agreed that there needed to be a public awareness campaign aimed directly at the African American community. We decided, and when I say we, I mean the African American Legacy Fund of Indianapolis, we decided as a group that we were going to take some funds that we had raised as a part of that effort to support a awareness campaign aimed directly at the African American community, and it actually launched this week. So,
Marshawn, I'm just going to interrupt you for 1 second. Everyone on the call may or may not know about the African American Legacy Fund. Would you mind just spending 1 minute on that? It's an exciting.
It's a new initiative that the African American community really launched. Basically, we believed that we, within our community, there's always this notion of the need to do for self. And so we decided to launch a donor advised fund that has both an endowment component as well as a giving circle component. We've raised roughly around $300,000. And so we're using a portion of the funds to respond to both COVID-19. And then we're also looking at other ways to respond to the needs of the Black community. So it is a partnership with the Central Indiana Community Foundation and basically over 80, nearly 100 actual funders from the community just saying, hey, I want to be a part of this. I want to figure out ways to help our community. And so we were basically well positioned to respond and react because we had launched the fund. And I know Tony is one of the founding members of the fund. But so we've launched a public awareness fund or a campaign that is called Let's Stay Together. Following the Al Green song. I don't know much about music, but I know the Al Green song. And so the idea is figure out how we can get our Black community to stay together conceptually on the ideas of social distancing and being all on the same page so that we can be together, all of us be together when this is over. And so you'll see some radio spots. You'll hear some radio spots this week. There's already been some videos up on social media. Channel 13 did a story on the campaign just yesterday. The first video came out with Pastor Johnson. So he's talking about Let's Stay Together. Finally, one of the other things that we've been doing as we're looking at the Black community as the African American Coalition is we're trying to focus on our grassroots organizations. Our grassroots organizations were able to move quickly and expand their operations. And they were able to be creative and innovative in their approach. And so one of the things we're trying to do is both highlight them in our relationships with the media. And so you'll see a story in the Indy Star. I think you actually saw a story in the Indy Star this week about one of those grassroots efforts. And then we've also been working with our other organizations and philanthropic institutions to actually fund our grassroots organizations. And again, appreciate the Urban League and stepping forward and providing some support to some of our grassroots organizations. So when you're thinking about the African American Coalition, it is a collection of all of the different Black organizations. And so it's the organizations that are doing the work. When you think about what AACI's work is basically an information exchange where we're trying to put ourselves in a position to have the right data to react, letting other folks know, letting the left hand know what the right hand is doing, and then, trying to, I guess, encourage certain actions in order to move the entire community forward. And so that's pretty much the work that we've been doing thus far.
Thanks, Marsha. And that is amazing. I especially want to highlight a couple things. I think the opportunity to help ourselves. We all, as communities, feel so much more valuable and validated when we can help ourselves. It doesn't mean we don't need partners behind us or alongside us or resources around us. But the thing to me that was so exciting about the fund was it was really like a recent big effort of multi-generational approach that was super visible, at least from a social media platform. So it was really cool. And Tony, everybody from the exchange is involved in it, I think. Yes. So yeah. It's pretty fantastic to see out there. Before I turn it over to Representative Porter, I think because it dovetails on this, if there are families who want to be engaged and want to help and want to be supportive during these times, and maybe it's not as appropriate for them to be on the front lines, donating to the League, donating to the Legacy Fund, those are probably excellent ways for them to be great partners. Are there other organizations besides CICF, African American Legacy Fund, and Urban League that people should keep top of mind as philanthropic institutions to be impactful during, really into perpetuity, but today in particular?
I would add in the Indiana Minority Health Coalition.
Indiana Minority Health Coalition, yep.
Yes, and then we also have several United Neighborhood Community Centers. So when you think of those, you're talking about the Bonner Center, Edna Martin Christian Center, Flanner House, Kristen Moore House, Faye Glick Picard Center. There are a number of them that are doing outreach work every single day in the community, everything from job training to food distribution to child care.
Wonderful. So I think one of the things we can definitely do as a follow-up to our participants today is we'd love to gather some resources that would love for you to keep them in mind during this time to make sure that we can get funds directed in that way. I know in our family, the Bonner Center is near and dear to our heart, and we're quick to accelerate our family's annual gifts in that direction. We figured they needed it now more than the end of the year. So wonderful. We'll come back to this. Representative Porter, I want to make sure you get the opportunity to speak today, and a question came in while the others were speaking that I thought maybe you could help us with, though I know you have some other things to cover. But if you would keep this in mind, and everyone should also think to weigh in on this, because this is really an interesting question. Coming off the concept of communities helping themselves, because not everybody looks the same in the medical profession, and there's probably a lack of Black and brown faces in some of the areas of the medical profession. There's some notion that maybe folks in the African American community don't feel as safe there, that maybe there's been some distrust created between the medical community and the African American community because of some abuse and maybe discrimination that has occurred. And I mean, there and many other spaces over the course of time. And so while you think about your own comments, are there things aside from the public awareness campaign that's clearly so necessary, but that other members of the community to do to help in addressing some of that stigma? So just everyone keep that in mind. As Representative Porter, I'd like to turn it over to you at this time. Okay, thank you very much. It's a pleasure to be here to just give a cursory review about what's going on here at the Marion County Public Health Department. We look at this situation as a way to really address the medical needs of our community, particularly African Americans and people of color. COVID-19 has resonated throughout this community in a way that no one ever thought it would, particularly here in Marion County. Representative Shackelford talked about some of the numbers and zip codes and
and so did Tony also. But I think from our perspective, in reaction to the zip code, and if you understand, we did a report about 3 or 4 years ago and said essentially someone that lived in 46205 versus 46202, they life expectancy was different by about 3 to 5 years. And we're talking about less than a mile and a half from each other. So when we talk about what was happening here, COVID-19 has done, like I tell and Tony will understand, is what No Child Left Behind did. We talked about No Child Left Behind education, but when you disaggregate the data, you saw where minority children of color, were being left behind. In regards to COVID-19, what has happened is that we find that the African Americans are 2 to 3 times more to die from COVID-19. And that is not necessarily because we're white people or other people getting as sick as they are, but because of the implicit bias that happens in the medical community. And you kind of touched on that a little bit in regards, how do we address that? Because there's an implicit bias when we go to the doctor at times. I think I'm going to hit on a couple of things in regards to the zip code. The zip codes, and we have looked at the zip codes of people who have passed away from COVID-19, and like in 46260, we've had 45 people who have passed away from COVID-19. 46205, there have been 5 individuals. 086, 18, Representative Shackelford, 23, and also in 46220, we've had 30 individuals. So if you can see what was happening, where people are passing away in Marion County from their perspective. So what Dr. Kane has done under her leadership, along with her team, has become say, okay, we're going to address this. We're going to look at the fairgrounds as a way to go through and test people, where we have areas that we're addressing the homeless needs, working with Wheeler Mission to address this COVID-19. Those individuals that are there that have COVID-19. We started our last week, starting with Eastern Star to test people in Eastern Star. That's crucial. We can talk about the numbers, but you have to test people in order to figure out who has it. So what we've done at Health and Hospital Corporation, Marion County Public Health Department is come back and gone out into the community. We're not saying y'all come to us, but we're coming to you. And so we've been at Eastern Star. We're there Monday, Wednesday, and Friday. We're looking at some other locations right now on the west side of Indianapolis. We're also looking northwest side of Indianapolis, because guess what? There's another population out there. It's the Hispanic population, which we're not really reaching at the way that we want to, and we have to hit that population, because those are the ones that are on the front line. Those are the ones that are working in a restaurant. So we have to address those things also. Robin talked about the Indiana Minority Health Coalition. We're working with them to continue to go out into community and not only looking here in Indianapolis, but throughout the state of Indiana in regards to testing people throughout the community. As we continue to look at the COVID-19, we have to, one thing that we look at our numbers. Our numbers say this: since 2008, we've had 25% growth of minorities in the Indiana and Indianapolis community. 25%. But our dollars that we give toward minority health that has not grown at that level, it's being cut, or it's being, or we keep it from the budget perspective, or it's being set straight. It's been straight line. To me, if you don't pass or give more people dollars over a 2-year period and say we're gonna keep it the same level, that's a cut. And so when you look at where we are in regards to the minority participation or minority increase versus the budget, it isn't there. The Indiana Minority Health Coalition is an excellent way to do that. We have epidemiology center there, but it has been funded in the last 3 or 4 years at the level that it should be. So you have to have money in regards to addressing the needs of our community. So, you know, when we look at policy changes from the legislative perspective, we have to continue to fight to put more dollars in those communities or within the budget so we can address the needs of individuals within the state of Indiana. There's not a lack of funding there. There's a lack of will to fund those programs.
Those are some excellent points. We're hearing about all the different ways. I mean, really, it's a deep, multi-pronged approach that we have to take to move the needle forward on any level, whether it be from policy to funding to allocation of funding to awareness to engaging multiple partners within the community. You guys have your work cut out for you. Those are a lot of different moving pieces to keep in play, and from an already systemically disadvantaged perspective from where I sit. We have several questions coming in, and we're running up on time, so I want to make sure we hit on a couple questions. We've referenced this a little bit. I'm probably biased, having spent a little time at Eastern Star and seeing Pastor Johnson before. I know the level of engagement that Eastern Star has and the passion that area has really, what he's trying to do, from the Rock Initiative to all the resources over there. But would anyone like to talk a little bit about the church's leadership and engagement? We're the Jewish Community Relations Council,
Sure.
so sorry we're going to ask this, but would anyone like to spend a minute on that today? Sure,
I can speak about Eastern Star Church. I know that in speaking with Pastor Johnson recently, Eastern Star Church is serving 6,000 people a week through its outreach services. And so that's food, clothing, you name it. And of course, you mentioned the Rock Initiative, where essentially the church has taken on the challenge of helping to revitalize the 46218 zip code through housing revitalization, job opportunities, training, you name it. The faith-based community is a big part of the outreach effort. I know at the Urban League, we have also partnered to support efforts such as Evolve, which involves the Hovey Street Church with Pastor Nell Howard. They're outreaching with Before You Fall and several other community churches to distribute food to over 1,000 people each week. They're also doing wellness checks on families. We are also partnering with the United Northwest Development Partners, the faith-based partners specifically, and they're distributing food to nearly 2,000 people each week across 3 or 4 churches. And so the faith-based community is actively involved in COVID relief efforts, but by and large, our faith-based community has been involved in different degrees, attempting to address issues and disparities that face this community. That's been a part of their work every day, every week, if you will, before the pandemic, and I'm sure it's going to happen during and beyond the pandemic as well.
The only other thing I would add is that, because I saw one of the questions, I appreciate the fact that Black pastors have come out and basically said they're not opening their churches. Now, I know the group that we heard it from, there's a lot of different groups, but it seems to be an emerging consensus within the Black church community that they will not be opening at this time due to concerns about COVID-19 and its disproportionate impact on the Black community. And so I think they've been very responsive and responsible, and they have really been leading a lot of the grassroots efforts in trying to respond to COVID.
And I just wanted to touch on the funding aspect. First, for Eastern Star, I just want to shout out, that's been my home church for 25 years. And it has been a blessing to have them over on the east side and the different locations helping out with our program. But because we know the churches have done so much, they've also lost a lot of revenue during the stay-at-home order, because a lot of people don't tithe if they don't consider themselves going to church in person. Yeah. So you have these churches that have missed out on this revenue, but are still trying to survive and help people. So one of our asks of the governor was include these churches in the outreach campaign, which is things they're already doing, and help replace some of that lost revenue that they've had during the stay-at-home order. We hear from the churches all the time that people want our services and the government want us to help, but we're not funded and we're not giving them any money to help. So with these COVID funds and them having to go in overdrive and help people and them having a loss of revenue, we just want to make sure that the governor understands that this is an asset, especially in the African-American community, that we can't afford to lose. We can't afford to have them shut their doors. And if we can assist funding in any type of way, any advocacy for that would be greatly appreciated.
Yeah. If I could piggyback on that, and in full disclosure, I'm a member of Eastern Star Church as well. You know, during prosperous times, typically 30% of a church congregation gives, and that's when they attend in person. That's my understanding. So much to Representative Shackelford's point, when people are attending online, that obviously has a far different impact, if you will. I know that I do want to address this, Jamie, if you don't mind. I did receive a question regarding history and a lack of trust from the African-American community. Experiments such as the Tuskegee syphilis experiment have greatly impacted the trust of African-Americans with respect to healthcare. So that's very real for some. And so you can only imagine how talks about everything from potential cures and treatments, how that lands with some. And so that is problematic, but what I would say is we have to continue to message to the African-American community using people that the African-American community trusts. We have to continue to advocate for equity, if you will, and also diversity with respect to individuals that are working in the healthcare industry and in leadership roles. And so that becomes an important part of this process from a long-term perspective as well.
Yeah, Tony, I'm not sure if you saw the other question that came in, kind of to continue on that, is actually also around that with improving health equity in those African-American neighborhoods. What do you know what kind of investments could be made? And maybe it's not today necessarily because we're in crisis management mode. I mean, we're just trying to respond to keep people fed and to keep people housed and to keep their lights on during this time. But as there is redevelopment going on in several of the zip codes that we've talked about today, and we could have longer conversations about gentrification and other impacts from that as well. But just if there were some things that could be top of mind as part of that community development and reinvestment, especially with respect to health equity, what are the things that you think should be top of mind? And we could talk about this forever. So after that, we're going to bring Lindsay Mintz on to wrap us up. But please, we'd love to hear some of your thoughts about that today.
Yeah, I think from our perspective, you got community healthcare centers. The state of Indiana does help fund that. We need to work with CMS and other groups like that at the national level to understand that it's access to healthcare. Okay, if we don't have the access, we can't address the needs of our community. And it's very important that people understand that we have to have community health care centers within our communities, a way to get there. We have to have transportation to get there, and to have access in order to have good health care and conversations. And lastly but not least, you're right, we have to have people that look like us that are physicians. And you know, we started the George Rawls Scholarship Fund years ago, and we just had to create more physicians within our communities that are willing to come back home to be physicians to work with us.
So I would echo all the sentiments of Representative Porter, and I would add that a poor person in Marion County has a 4.5% chance, if they're born in the 20th percentile of the income distribution, to move to the top 20% in the income distribution. So basically, if you are born poor in Marion County, you only have a 4.5% chance of getting out of poverty. And so one of the ideas that I actually put in the IBJ, it should be coming up next week whenever they do the Forefront magazine, is let's be more aggressive with ideas like baby bonds. These are instruments where you give a young person a trust and you give them a little bit of money and you invest over a certain period of time. And by the time they're 18 or 21, it's an asset now that they can use for education, starting a business, or home ownership. I'm looking for those kinds of investments. It's something that the government has done in the past, but they've stopped. So I'm really looking more towards the philanthropic community to step in on those kinds of things. The other piece that I would add is when you think about Black home ownership, it's extremely low. It's around 33%. Latinx is around the same at a time when the when the white community's home ownership rate is in the 60s. Our homes are devalued by at least $19,000 in part because we don't have amenities like health centers, but also grocery stores. Most Black communities are in food deserts. And so we have an issue of really a food apartheid, which leads to, obesity, diabetes, and all these other underlying health conditions. So there's a few things that I would be looking at if we're going to take this on.
And I would agree with Marshawn. I think our policies and got to be more proactive, especially when it comes to health disparities. And it has to touch not only health, but economics and education. They all go hand in hand. I just wanted to touch back on the racism and biasness that some of our African Americans are feeling when they go to health providers. We have requested that some type of matching fund be set up to those healthcare providers who want to take place in an anti-bias or anti-racism training, because we know we have put legislation forth before saying that healthcare providers should have this type of training. We'll also put it forth again, but just trying to put some funding behind that. But yeah, there's many solutions and positive solutions that we can start implementing, because I believe we're going to be affected for years to come because of COVID. It's going to go on for about 2 or 3 years. So a lot of these solutions can be long-term and we can still be developing them.
You're so right. I think that's one of the only good things that come out of these situations are the opportunity for us all to take a pause and shout very loudly about things that were already problems, but now we can't look past them anymore. They are so transparent and obvious at this point that hopefully we can retain the microphone long enough to affect some change. And at the JCRC, we're so grateful for the partnership of all of you, and for being here. I feel like we could talk about this all afternoon. We have barely scratched the surface. I'm getting more and more questions, and I have 3,000 questions of my own for all of you, so I'll probably call you all later. But before we go, first, I want to thank you. You all mean so much to me. I get to interact with several of you personally on a regular basis, and I'm thankful for your partnerships in the community and for everything that you do and for the people that you have trained to have become my companions in the world as we try to make it a little bit of a better place. And I am going to turn it over to our Executive Director, Lindsay Mintz, to say a few parting words.
Thank you so much, Jamie, for hosting today's conversation, for facilitating the discussion. Hello, everyone. I am Lindsay Mintz, and I'm really honored to be the Executive Director of the Jewish Community Relations Council. And Jamie is one of our vice presidents and has been an active member for over a decade at this point, at least, helping us build these relationships. I mean, relationship is in our name. And for the several dozen people who've joined this conversation today, maybe wondering, what is the JCRC doing facilitating this particular conversation right now? Part of our job is to face both directions. I mean, as you've said, Jamie, through JCRC in many ways, you've built relationships, personal, professional, communal, with members of the Black community. I've built relationships with my counterparts, like Tony Mason. Certainly our presence in the State House allows us to build relationships with leaders like Representative Porter and Representative Shackelford. But the JCRC also faces the Jewish community and understands part of our responsibility is to help bring the life experiences and challenges of our neighbors and friends into Jewish conversations and into Jewish spaces. And that kind of collaboration can only happen when there's some understanding and empathy. And I can tell anybody who's joined us, who's a member of the Jewish community, every panelist you see here reaches out to members of the Jewish community and JCRC when they want to understand how we are feeling and how we are doing in this moment, a little bit broader than COVID, but in the world today with the rise in anti-Semitism, everybody here is as interested in us as we are in them, and that's what relationship building is. We're gonna share this podcast. It's not a podcast. We're going to share the webinar. We'll post it online. We're going to share the names of the organizations that were referenced and links to those. We're going to do these again. This is going to be a series. This was our first. Every other Wednesday at 1, we're going to host a conversation about some aspect of, civil society, civic society, and how we are grappling during COVID and beyond. On the 20th, we will have a conversation around election matters. And following that, we're looking at a conversation around the philanthropic sector. So we'll loop back around with organizations like CICF and Lilly and United Way and Urban League and see, how we are delivering services to those most in need broadly. There's no shortage of conversations that we should be having and that the Jewish community is interested in having. So I want to thank Representative Porter, Representative Shackelford, Tony, and Marshawn for joining us today, for Jamie for facilitating the discussion, and for everybody who took an hour out of their day to grapple with and just start to scratch the surface of a really important and challenging issue. So thank you all, and stay safe, be healthy, and we'll see you in a couple weeks.
We hope to see you soon. Thank you.
Thank you. Bye.
Bye.